Is this the best we can do? Mandating private insurance, forcing people to buy private insurance policies or pay a penalty, guaranteeing at least $50 billion in new business for the insurance companies? Is this the best we can do? Government negotiates rates which will drive up insurance costs, but the government won't negotiate with the pharmaceutical companies, which will drive up pharmaceutical costs. Is this the best we can do?
You plan on voting for a health care bill in the House that does not have a government-run or public option?
That bill, as presently exists, is really not sustainable and can't be supported.
All right.
I don't intend on voting for it unless something dramatically changes.
39 Democrats voted no on the House health care bill. One of them is Congressman Dennis Kucinich.
Congressman Dennis Kucinich went so far as to vote against it.
If you don't get a robust public option, would you vote against the bill?
This bill represents a giveaway to the insurance industry, $70 billion a year, and no guarantees of any control over premiums, forcing people to buy private insurance. 5 consecutive years of double-digit premium increases.
You say that's a victory for the insurance industry. You couldn't go along with that. Would you vote against that?
Well, I'll tell you, I would have great trouble voting for anything other than a robust public option, because that saves money. It provides more health care for more people. Otherwise, what we're looking at, Ed, is we're looking at the poor having to pay more. We're looking at the government having to pay more. This ends up being a larger bailout to the insurance industry.
It forces people to buy private insurance, makes them pay a penalty if they don't. People pay twice. They pay first from their own pocket and they pay second through their taxes. It's the wrong business model. I mean, insurance companies are in business to make money. In healthcare, they make money not providing care. Really, the key issue, is healthcare a problem? You bet it is. Would it be helpful if everyone in this country had healthcare? Yes, it would, but not in the giveaway to the insurance industry.
First of all, the public option that was offered in the bill wasn't much to begin with. The whole idea was it was going to encourage competition between insurance companies. So if you don't have that, that means there's no competition between insurance companies, and that means the costs are going to go up.
What do you say to the president and Democrats who say, let's get this passed and then we can build on it with future legislation?
You're building on sand. There's no structure here. You're building on a foundation of privatization of our healthcare system. That's the problem. The insurance companies are the problem. They're nothing to build on. We build our hopes on the insurance companies, and all we're going to have is more poverty in this country.
So what is all this about anyway, except, the government subsidizing private enterprise? And I don't think government should be interfering in the marketplace. I don't think it should be picking winners and losers in the private sector, but that's exactly what this bill does. A bill that no one understands, a bill that hasn't been well defined. We should go back and listen to the American people. But we can't get away from our responsibility as members of Congress who have pledged to deliver health care to the American people, and we've got to make sure it's health care, not insurance care.
This is the insurance companies getting carte blanche, and the Congress really giving up its power.
So did we just get a no there? Congressman, will you vote against the Senate bill at the first stage of this process in the House?
If that sounded like a no, you're correct.
You've been a solid voice on this all along.
Do you think Dennis Kucinich, who says this bill is not liberal enough, will say it's liberal enough today on his press conference and be a yes vote?
I think he perhaps could be the cheapest date yet.
If my vote is to be counted, let it count now for passage of the bill, hopefully in the direction of comprehensive health care reform. After careful discussions with President Obama, Speaker Pelosi, my wife Elizabeth, and close friends, I've decided to cast a vote in favor of the legislation.
And now Dennis Kucinich will be a yes vote on the current health bill.
Well, Congressmember Kucinich, you did not get what you were asking for, yet you are now supporting this bill.
And I was basically, by virtue of circumstances, being put in a position where I could either kill the bill or let it go forward, and in the hopes that we could build something from the ruins of this bill.
What do you say to the president and Democrats who say, let's get this passed and then we can build on it with future legislation?
You're building on sand. There's no structure here. But there's a point at which you say, it's my way or the highway, and if the highway shows a roadblock and you go over a cliff,
I don't know what good that does when you take a detour and maybe we can still get to the destination. Businesses have credit and helping keep people in their homes. So this whole agenda is really waiting for us to pass the health care bill, and then we move. And I decided to give the bill a chance to live so that we can have reforms, more comprehensive reforms down the road.
There's a report out on a progressive blog that they're saying that you would sign this pledge to vote against any bill that did not have a public option. This bill does not have the public option. And they're saying that online supporters donated $17,000 in direct response to that pledge. Do you know, sir, is that number accurate? And if so, will you return the money?
Yes, because people who gave money with the expectation that I would vote no,
Yeah.
They certainly should have that money back, and that'll happen.